start one more topic regarding to pharmacology, what it is called as anti-emetics. So anti-emetics is a word which is showing you something against the word called emetics. So we can understand that what is emetics. Emetics is a word known as to driven out or to taken out. So what we are trying to taken out and why it is happening. So this is all related to a word called emetics. Now if you see the emetics word, it is always related in 4 to 5 areas. That means the vomiting is being stimulated by 4 to 5 functioning of our body functioning. So what is that? One is called gastrointestinal cavity, which is being connected from your gastrointestinal tract to the medullary centers. That means by a nerve called vagus nerve. So whenever we have a stimulation in our stomach, whenever this center is being stimulated, whenever we want the unwanted food or unwanted chemicals which are being stimulated by our stomach, it has to be thrown out through the gastric cavity. Nothing but it enters from the, or it is passed out from the nose, or it is passed out from the mouth. So this is the one center, and the other center, what we know, it is called as a CT jet center. The CT jet center is nothing but known as chemo trigger zone. So we can understand by the word called chemo, something is triggering that chemo, isn't it? Chemicals, and the chemicals are triggering that particular zone. So what we can call it as CTZ center, and this is present just outside the BBB. That means your brain blood barrier, which is being stimulated just beside another center, what is called vomiting center. This vomiting center is called as VC, and this is present in medulla oblongata. And when we see this CTH center, it is being worked by various receptor and various functioning of that receptors. The first receptor which is functioning on this CTH center is muscarinic receptor, nothing but your parasympathetic nervous system's sympathetic receptor. Or we can say that parasympathetic, we know that the parasympathetic is having two receptors, one is M and the other one is N. Here the muscarinic receptor has been present onto the CTJ center, and one other one which is present onto this CTJ center is nothing but D2 receptor. So what is this D2 receptor? D2 receptor is nothing but called as a dopamine receptor, and the other one which is called as NK1 receptor, nothing but neurokine receptor. So these are the three receptors which are present onto the center called CTZ, which is just present outside the BBB, and this is the second one which has been triggering your emetic. And now we'll come to the third center, which is called as vestibular nuclei, and this vestibular nuclei is present in the corns of, we know that they have different foci of the brain, which is called as corns. So they are present onto the corns of the brain stem, and this vestibular nuclei is being functioning by one more three receptors over here. The first receptor which is functioning on the ventricular nuclei is histamine receptor, and the other receptor which is functioning for this is muscarinic receptor, and the other one which is functioning for this vestibular nuclei is nothing but NK1 receptor, nothing but neurokine receptor or neurokine 1 receptor. So if you see the center called CTZ, it is functioning by three receptors, nothing but your M, D and NK1. Now if you see this vestibular nuclei, it is functioning by three receptors over here. One is muscarinic, the other one is histamine, and the other one is NK1. If you see this vestibular nuclei is always runs with the function of motion sickness. That means it is having a connection between your ears through the vestibular nuclei and the vestibular nerve, which is being passed to your ventricular nuclei, and this ventricular nuclei is once more triggered or being joined up to the CTJ center, and what that CTJ center is once more linked up to your vomiting center, which is giving you, inducing or make a more stimulation of emeti. If we see the word here motion sickness, we can understand that there is something sickness related to motion. That means something related to sickness to the movement of something. So if you see, sometimes whenever we have been traveling from one place to the other place by different modes of vehicles, nothing but your car, your vehicles of like aeroplane, and we have a vehicles called train, and we have a concept of bus, isn't it? A lot of people, or most people, they go on traveling by the bus, and also if we see a little more, they have been traveling by car. So what we can see, there is something movement in the vehicles. That means it is making something movements where the air has been collected by a vestibular. We know that the vestibular, something vestibular, nuclear vestibular nerve which are present in the labyrinth of the ears, which has been collected, the air has been passed through your ears, and this vestibular is directly connected to the ventricular nuclei which is present onto the corns of your brain stem. So there is a connection between your ventricular nuclei and the labyrinth and also the ventricular nerve. And so whenever we have a air sickness or whenever we have a motion sickness, the air has been passed out, which has been stimulated your ventricular nuclei, and furthermore it is stimulating a center called CTZ, and once more it is inducing a word called emetics here. Now this is the second one. Now coming to the third one, which has been stimulated by the vomiting, is your gastrointestinal cavity. We know that the substances which are being absorbed into the stomach or absorbed into the small intestine, where it is not able to accommodate itself, where it is not able to driving into itself, it has been stimulated by various chemicals which cannot, or it is irritated by some chemicals which cannot keep the food into the stomach. So whenever this type of stimulations or whenever this type of inhibitions or inducings happens, we can see that they are releasing two receptors or the two neurotransmitters over here working by various receptors. One is called as serotonin, which is being released into the enterochromaffin cells of the lumen of your stomach, and also we have another substance what is called substance P, and these two neurotransmitters are being released by various chemicals which are being able to drive the food out. So here we can understand one more point over here. What is that? The drugs which are acting on the cytotoxic drugs. So what we can understand, these are the related drugs where the chemotherapy is taken by the cancer patients. The radiation has been passed to the cancer patients where it has been inhibiting or inducing, or it has been stimulating all the chemicals so that it is not able to keep the food, whatever it is, into the stomach or into the absorption to your small intestine, has been developed out or evolved out or taking it out. So these we can understand that the cytotoxic drugs, the drugs related to various chemicals, the radiations what we give. So these are the different types of chemical types of toxic substances which can be taken up and they can be passed out by a stimulation of two neurotransmitters, as I earlier said. One is called as serotonin, another one is called as substance P. And now when these two are being stimulated by variant stimulants or variant receptors, what is called as 5-HT receptor and also by substance P receptor, has been taken up by the vagus sensory nerve, which has been connection between the gastrointestinal cavity and to the brain, which has been driven out, or the stimulation is passed out to the CTZ center, and the CTZ center is collected by your vomiting center, and it is been inducing the power of evolving the substances which are being present in your gastrointestinal cavity. And now we'll go to the fourth point, that